Good afternoon, friends. I'm Dr. Ajay Shah, bringing you another live. Happy Thanksgiving to all of you. Hopefully, you all are safe and keeping the social distance, wearing your mask, and celebrating Thanksgiving in a virtual way as much as possible. Obviously, having close family members are okay. Like kids and parents, and but try to keep the gathering as small as possible and maintain the social distance. Today, I'm bringing you actually a special topic, very, very common and very timely topic, and that's about the high blood pressure. And I'll tell you how I got off my blood pressure medicine over the last 2 years. 50% of Americans have high blood pressure, so it's very, very common, very prevalent. And actually, high blood pressure is number one preventable cause of death in the world. Number one preventable cause of death in the world. It's a silent killer because high blood pressure does not hurt. When people have high blood pressure, there are no symptoms. As a matter of fact, 30% of people who have high blood pressure don't even know that they have high blood pressure. As I explain you, and as I guide you to get off the blood pressure medicine, please do it under your physician supervision. I don't want you to go off medicine unless your doctor obviously asks you and tell you to go off the blood pressure medicine. But let me assure you, if you follow what I'm going to show you today, you can get off the blood pressure medicine in 3 to 6 months. Um, Actually, recently I came to know that people whose blood pressure is normal, that means 120 over 80, but even if they are on blood pressure medicine, their mortality is high. So, like I said, even people with normal blood pressure on medicine, mortality is high. So, best thing is to get off the blood pressure medicine. The goal of the blood pressure is 120 over 80. You all should have a blood pressure machine at home and measure blood pressure at least 2, 3 times a week. Actually, after age 40, everybody should own a blood pressure machine. And even there is a myth that aging causes the high blood pressure. That's not true. A lot of people in their 80s and 90s who maintain healthy lifestyle, particularly in blue zone, don't have high blood pressure. So let's start how you can get off the blood pressure medicine. First thing, most important thing is cut down on your salt. As American, we eat a lot of salt. We need to cut down the salt ASAP if you have high blood pressure. Try to eat 1500 milligram of sodium maximum per day. So again, cut down the salt ASAP if you want to get off the blood pressure medicine. And there are a lot of salt in a lot of hidden foods. Almost all processed food have a lot of salt. So be careful when you eat processed food. Best thing is to eat whole food, plant-based diet without any salt. So again, cut down the salt to 1500 milligram maximum. Second thing, which is very important, is to cut down on the weight. If you are overweight or obese, bring your body mass index down to 22 or below. If you lose weight, blood pressure will come down. That's how I actually brought my blood pressure down. I lost about 50 pounds and my blood pressure is gone now. I also don't eat any salt at all. At our house, we don't use salt at all in our cooking. And even when I go out, I try to make sure that I select the dishes which has a low salt. Again, lowering salt, losing weight to bring the body mass index to 22 will bring your blood pressure down. The third thing you can do is 30 to 60 minutes of exercise. Simple walking is good enough, but if you can add some weight training and some flexibility training, that will also bring your blood pressure down. So again, let me repeat, cutting down on the salt, losing weight to bring the body mass index below 22, and 30 to 60 minutes of exercise 30 to 60 minutes of exercise will bring your blood pressure down. Next thing is some form of regular meditation. And you can learn meditation by various YouTube videos, but simply closing eyes and eliminating all the external stimulus as much as possible will bring you into meditative state. So meditation for 15 to 30 minutes a day will bring your blood pressure down. Some form of stress management is also very important. So being proactive, planning the life, maintaining a daily journal, not getting angry, keeping calm and cool, also lowering your work-related stress also will bring your blood pressure down. The next important thing is sleep. People who have poor sleep have a high chance of high blood pressure. So try to get at least 7 to 8 hours of sleep. So let me repeat everything again. Number one, cut down on your salt. Number two, lose weight and bring body mass index to 22. Number three, exercise 30 to 60 minutes every day. Number four, stress management and meditation. Number five, regular sleep, 7 to 8 hours. And sleep you can actually track, so that will make sure that you are getting good deep sleep and good REM sleep. Next thing, which is very important, which I've been promoting for last 4 years now, is having a high potassium food, high magnesium food. And high potassium comes actually from whole food, plant-based food, green vegetables, fruits, and beans. So again, having green vegetables and beans and the fruits will give you high potassium, and that will bring your blood pressure down. Potassium actually counterbalances the effect of sodium, and blood pressure will come down. Beet and garlic type food also has significant effects on the high blood pressure. Next thing is having an adequate vitamin D. If you are living in an area where there is not enough sunlight, taking a vitamin D supplement will bring blood pressure down. Maintain vitamin D level anywhere between 40 and 70. Next thing is alcohol. Obviously, we all like small amount of drinks once in a while. But if you want to get off your blood pressure medicine, first thing you can do is cut off the alcohol completely if you can. If you drink alcohol, even 2 or 3 drinks, blood pressure will stay high. So cut down on the alcohol as soon as you can and stop it completely if you can. Obviously, a rare glass of wine is okay, but ideal thing would be no alcohol. Alcohol definitely raises the blood pressure. Next thing is if you have a sleep apnea, if you are overweight, if you have a body mass index about 30, about 35, there's a good chance that you have a sleep apnea. Treating sleep apnea will bring your blood pressure down. Again, treating sleep apnea will bring your blood pressure down. The smoking also causes a high blood pressure. Nicotine is vasoconstrictor. That means it constricts the blood vessels and causes a high blood pressure. So quitting smoking will bring your blood pressure down. Um, Adequate hydration is also very important. Try to drink at least 64 ounces of water every day. That will eliminate some of the sodium from the body, and that will bring your blood pressure down. Also, having no sugar in your diet will lower the insulin level. Insulin also is a vasoconstrictor, and that also keeps the blood pressure high. So eliminating sugar will also actually lower your blood pressure. Also prevent vascular disease. When the blood vessels get narrower, blood pressure goes up. So preventing vascular disease by keeping the cholesterol low, by not having oil in the diet, not having saturated fat in the diet, uh, and preventing the chronic inflammation will lower the vascular disease and will help long term with the blood pressure control. Also, some form of yoga or stretching or flexibility exercise also is shown to cause lowering the blood pressure. Also, observing breath as much as possible throughout the day and learning some breathing technique will also lower your blood pressure. Also, certain supplements, including magnesium, coenzyme Q10, and hawthorn, can also lower the blood pressure. So you can read more about supplement and try the supplements also. Caffeine also can raise the blood pressure. So if you are trying to get up the blood pressure medicine, eliminating caffeine would be a reasonable thing to do. I have only decaf coffee now, which I probably should be eliminating also. So again, caffeine elimination will help you to lower your blood pressure. There's also some data that tea, particularly hibiscus tea, can lower the blood pressure. So if you like sipping on something, try sipping on hibiscus tea, and that will lower your blood pressure. Regular exposure to sunlight also lowers the blood pressure. Also, maintaining healthy microbiome will also lower the blood pressure. So have a fermented food, have a plant-based yogurt, or have a probiotic supplement, and that will lower your blood pressure. Also, noise reduction is very important. So if you are in any kind of noisy area, try to see if you can lower the noise in your day-to-day life, and that will bring the blood pressure down. Also, treating secondary hypertension, very important. Secondary hypertension is the one where blood pressure is elevated for some other reasons. And some of the common reasons include adrenal gland disorders, even low thyroid, like I said, sleep apnea, certain other vascular disease like kidney artery blockage that can keep the blood pressure high. So Ask your doctor to make sure that your doctor has ruled out any causes of secondary hypertension. That means blood pressure is not coming from some other reason or some other cause. In young women, particularly, birth control pills is very common cause of high blood pressure. So if you have high blood pressure, try to ask your doctor to see if you can use some other form of method instead of birth control pills. Also, being on estrogen can also increase your blood pressure. When you see your doctor, ask the doctor which medicine is best for your blood pressure. Obviously, goal is to get off the blood pressure medicine, but while you are on blood pressure medicine, make sure your doctor chooses the medicine which is best for your type of medical condition. Also, another important thing, if you are on blood pressure medicine, take the blood pressure medicine at night because blood pressure is highest around 2 or 3 o'clock in the morning, and that's when you need the blood pressure medicine most. So make sure you take your blood pressure medicine in the evening or just before going to the bed, and that way that medicine will be working all night and control your blood pressure. Again, I covered a lot of ways of getting off the blood pressure medicine. Let me tell you my story. 4 years back, I was on two blood pressure medicine. I lost 50 pounds. I've gone on decaf coffee. I've gone on the alcohol. I need to go off completely. I sleep 7 to 8 hours. I have a high potassium, lots of vegetables food. I lower my stress. I do meditation every day, and now my blood pressure is normal, typically between 110 and 115 without any medicine. So I can pretty much assure you and guarantee you that if you follow what I just showed you, you can get off a blood pressure medicine. Obviously, it will take 3 to 6 months, sometimes even a year, but you will start seeing the changes in blood pressure within 1 to 2 weeks if you follow what I just asked you. So lose weight if your body mass index is about 22. Eliminate caffeine and alcohol. Lower the salt, no more than 1500 milligram. Actually, eliminate the salt from your cooking as much as possible. There's enough salt in a natural food. Do some form of stress management. Eat high potassium, which is green vegetables, fruits, and beans food, and your blood pressure will start coming down. So I hope this video was useful. Please share if you like this video. This video will be on YouTube. So you can also watch it on YouTube. Again, these are some of the methods where you can actually get off the blood pressure medicine. Let me know your experience, comment, and share if you think this video will help other friends and family who have high blood pressure. Thank you.